In a landmark move, the National Human Rights Commission of India held a meeting with the stakeholders from the medical community yesterday, that is Wednesday, April 24th. What was this meeting about and what are its outcomes? Let's explore this in today's episode of Straight Up by edX Live. The Core Committee meeting by the NHRC, which took place at the Manav Adhikar Bhavan in New Delhi, pertained to the rights of doctors and patients in India. Stakeholders present in the meeting included the officiating chairman of the National Medical Commission, Dr. B.N. Gangadhar, Secretary of the NMC, Dr. Professor B. Srinivas, delegations from prominent doctors' associations such as the Federation of Resident Doctors Association, Federation of All India Medical Association, and the United Doctors Front, medical experts, and others. Justice Arun Mishra, chairperson of the NHRC, chaired this meeting. The meeting saw a discussion of various agendas such as the impact of the bond policy on medical students, stipend dispersal to medical interns, the establishment of anti-ragging committees in medical colleges, and the overall physical and mental well-being of doctors, amongst others. The bond policy, which contractually mandates medical graduates to work in a specific area or healthcare facility of a government agency or medical institution after graduating, has been a cause for stress, depression, and even suicide, especially amongst postgraduate medical students. Therefore, discussions around it were a predominant aspect of the meeting. As for the dispersal of the stipends to medical interns, the officials from the NMC were hesitant to comment on proposals for a one nation, one stipend policy, as public health was a state subject. Further, the UDFA submitted their recommendations, which included a central law to criminalize violence against doctors and healthcare workers with strict enforcement and punishment, the establishment of an Indian Medical Services cadre, and more. This is what Dr. Lakshya Mittal, National President of the UDFA, has to say about the meeting.
There are a lot of rights of doctors that they are not given, but mainly we will discuss about the main points, that is decriminalization of medical negligence. Second one is there should be compensation point. There should be capping of compensation, maximum of total 5 times the hospital bill. And there should also a centralized protection law that should be protect against the violence to the healthcare workers. And there should be a centralized form where a patient can also lodge a form. There are so many forms, grievance portals are there, consumer court and other appropriate authorities. There should be one centralized form that should be benefited for both the patients and the doctors. Along with it, we have also suggested the government to the right of sharing the information of doctors to their colleagues about the violent patients, and that violent patients should be blacklisted and maintain a directory for them so that it can be helpful if the patient is gone to the other doctor for treatment.
Bearing what could be good news for the medical fraternity in India, Dr. Rohan Krishnan, chairman of FAIMA, who attended the meeting virtually, had this to say about what transpired.
All the points were taken very positively by all the stakeholders, and it was a very good collective approach involving the ground level workers like us and the policymakers like Health Secretary and the National Medical Commission. We have pointed out some of the important factors such as revision of bond policy, and the chairperson of NMC himself claimed that he wants the bond policies to be abolished, and they are working in that direction. Since health is a state subject, it has to be properly channelized, and state agencies has also has also to take part in it. So that is a long-going process in which initiation has already been started by National Medical Commission in the positive direction. And I think that we also discussed about the stipend issue, and there was a demand that uniformity in stipend in Pan India should be there. Our point was that if uniformity is difficult, at least one must have a minimum guarantee wage fixed for the interns and the medical graduates as well as the post-graduation students. So we discussed that medical stipend as well. Then about the mental health, it was the chairperson himself was the director of NIMHANS and former director of IBHAS, and Dr. Nimesh Desai, and consultant psychiatrist Dr. Aprajita Singh, and all were present there. So I think that it was a very positive meeting.
As per Dr. Rohan Krishnan, there will be more rounds of meetings following yesterday's meeting. This is what we have for you today. We will be back with more stories from the world of education tomorrow. Please like our video, share it with your friends, and subscribe to our YouTube channel. Don't forget to follow us on social media. Mask up, stay hydrated, and stay safe.